Welcome to Kids Matter. I'm Dr. Elisa Minkin. As a pediatrician, mom, and grandma, I understand how challenging it can be to help our kids grow into their best selves. We are so much more powerful together. Here, I will be sharing the knowledge and wisdom of a wide range of people who understand and care deeply about children. I'm hoping for your input as well because kids really do matter. They are our future.
Welcome back. Joining us today is Danielle Mizrahi, a licensed clinical social worker and certified perinatal mental health professional. Danielle specializes in maternal mental health, offering evidence-based care for the complex transitions of fertility, pregnancy, and postpartum. She is dedicated to helping women build resilience and thrive throughout the reproductive journey. She can be reached at 516-259-6964 and a link to her Psychology Today profile in the show notes. Danielle, welcome to the show.
Thank you so much. It's so nice to be here.
Thank you so much for doing this with me. So, first of all, we're just going to start with what is perinatal mental health?
Okay, well, that's a good question. So, perinatal mental health or reproductive mental health, or I guess those are the two main terms. Basically, it's the period, it's the mental health, obviously, of women who are going through that period in their life from the time that they even think about trying to have a baby through that postpartum period. So it includes a lot. It includes trying to conceive. It includes fertility issues. It includes going through IVF or adoption, anything related to that period of trying to build a family, and then after having a family. And I know that postpartum is, I guess, considered up to a year, but it really extends much more than that, and further than that. So when it comes to mental health, all of the issues or all of the aspects of what changes a woman goes through, what expectations they go into this period with, what really life stage that they're at. And a lot of times it's sort of not really given credit. It's not really taken into consideration that there's so much that does happen. And it's not just because there's something wrong, it's because this is just what it is, right? Like when we go through adolescence, right, there's this expectation that, oh, okay, the teenagers, they're going through a lot of hormonal changes. They're going through this period of growth and trying to find their identity. The journey to becoming a mom, whether it's, I guess, easy or more challenging, it's also a life stage transition. And I think in society in general, we don't really give that enough credit, right? Moms are just expected to be, instantly bonding with their baby, and the baby comes out perfectly, and, they're just thriving in motherhood. But the reality is there's so much more to it, and there's so many nuances and things that happen during that lifespan, that reproductive lifespan, that are normal and typical, and they happen. It's just not really acknowledged so much. So reproductive mental health or perinatal mental health is a field within the mental health world that addresses all of these issues that come up.
Incredibly important. And it goes way beyond the postpartum depression that we're trained to pick up. And you said a lot of that, we kept using the word expectations. I want to talk about social media because I think that social media has a huge role here. Sometimes good, but a lot of times not. What do you think?
Yes, absolutely. I personally have a mixed feelings about it, and just the role of mental health. It's the role of social media when it comes to mental health, because on one hand, you're right, you do have these messages or these pages that moms or anyone, I guess, who's experiencing, whether it's dads, moms, whatever type of couple or single moms, whatever it is that are experiencing or going through this period, there's these norms that are sort of created. And a lot of times the social media is very much relatable, but it also sets a standard of how things are supposed to look and how people are supposed to handle certain things that happen. So with depression and anxiety, right? If there's a page dedicated to postpartum depression, there's probably so many quotes and there's so much information on there that resonates, yet your journey may be very different through postpartum depression than what's being shown on that Instagram page. So where does that leave you feeling? How does it leave the person who's experiencing it?
Absolutely. Absolutely. And, I'm thinking of a book I read where this woman had two homes. She was an Instagram influencer, and she had one home, the perfect, like connected houses, one where it was a complete mess where they actually lived, and the perfect home where she, films her reels from.
Yeah.
I mean, people seem to like watching perfect, beautiful, airbrushed things, but it's like you said, it sets up expectations that are not realistic.
Yes,
It just keeps leading to this idea of the perfect parent, which doesn't exist.
for sure.
So I want to go through the different stages of this period that you treat patients in, and it would start with even before
Yeah.
they ever get pregnant, right? So I'd like you to talk a little bit about that stage.
Yeah. And I think the journey to become a parent, and I'll just say, not everyone becomes a parent, not everyone wants to become a parent. But for those who do want to become a parent, it starts way before they're even maybe in a relationship where they feel like they are going to try and conceive, right? How you see motherhood and parenthood really starts as a child. Like, I think about, playing with dolls and just what we're conditioned. Again, here we go with social society, but the way that we see this period starts way before. So when it actually comes time to try and conceive, or for some people, it's a surprise, or when that period of your life starts, how you saw it before will often influence how you feel about it, even before there's any struggle or there's any of just the stages of what it takes to actually become a parent, and pregnancy and postpartum and all of that. So it really starts way before there is even, I guess, an embryo, you could say.
Right. Right. And there's two different pieces, right? There's the trying to conceive, and then there's also people, and presuming that come to you, who are not sure they want to be a parent, or they have baggage, right?
Mm-hmm. Yeah, a lot of my clients will come to me saying, I don't know if I want to be a parent because I don't know if I can do it right, or that I'll be a good parent, that I can be who this baby needs. Or I don't know if I want to be a parent because I have my own attachment issues and I didn't have a supportive mom, or I didn't have someone who I felt like taught me how to be a parent. And a lot of times it comes down to really just how somebody feels about themselves, and whether they're capable of doing this. So we do a lot of exploration of that too, and what it would mean and what does it mean. And the reality is most people, I think there's this expectation that you have to know everything, and that you have to be perfect, and you have to have the perfect crib and the perfect, formula, and all of these expectations of breastfeeding, all of this, right? There is no such thing as perfect parenting. There really is not.
It seems to sell, though. I think that it creates anxiety, and anxiety sells, and it's really hard not to buy into it at all times.
Yeah.
But I love that you said that. And I keep saying we have to go back to the good enough parent.
Yes.
I want to say one thing about that period, though, that if you're the person that says, I want to go to a therapist so that I could be a better parent, and you're starting that early, I think you're a genius. I think it's a great move. I think it's really smart.
Yeah.
But if you are already pregnant, right, or you have a child and you realize that, it's never too late.
It's never too late. I think self-exploration, self-growth is a process. It's a journey throughout a lifespan. So what it means to go to therapy as a child is different than what it means to go to therapy as a teenager, or what it means to go to therapy as a 20-something who's trying to figure out, how they're going to move forward in their life and become independent, right? Life is a series of stages, and your identity changes as you grow. So there really is no wrong time. It's never too late to work on yourself.
Absolutely. And I want to move on to but I think they're called perinatal mood disorders, to take into account that it can happen both during pregnancy and after. We're moving beyond the postpartum depression, right?
Right.
And to encompass anxiety as well.
Absolutely. So there has been a huge shift in how, I guess, the postpartum mood disorders are seen. It used to just be postpartum depression, right? And there is a period after giving birth. So after a woman gives birth, the 2 to 3 weeks after giving birth, it's called like there's something called baby blues, and I guess it's sort of what's known a little bit more, like right where you can see the crying spells and the hormone shifts, and there's such a drop in certain hormones and an increase in others. And so during that period, it's sort of expected that there's going to be some mood disturbance as your body sort of adjusts to having this new, no longer being pregnant. It's really after the 2 to 3 period, if some of those symptoms continue, then we start to look at some of the perinatal mood disorders. So, and it's not just postpartum depression. There's anxiety, there's OCD, there's panic, there's, on the more extreme side, there's postpartum psychosis. And the reality is studies have shown that it's 1 out of 5 moms will experience some sort of postpartum mood disorder. And sometimes it develops right after giving birth. Sometimes it develops during. If someone struggles with anxiety, depression, or any mental illness before bipolar, whatever it is, the chances of developing, we call them PMADs, postpartum anxiety, mood or anxiety disorder, are greater. So it's not a one size fits all science. It's sort of a case by case, but
Right.
yeah.
Yeah. It's very individualized. I'm glad you're bringing up that somebody could have a pre-existing disorder, because you can start for the first time during this time period, or you could have a pre-existing disorder. And I would be a little concerned for somebody just writing off something as the baby blues if they have a pre-existing disorder that's getting significantly worse, even in an immediate period.
Yeah. Yeah. And I think the importance of seeking care or doctor offices, both OBGYNs and pediatrician offices, being aware and understanding the nuances of that mental health piece, the perinatal mental health piece, is huge, because those are the people that are going to be able to see it, right? A mom comes into an office with their baby, once every few weeks to a month, for the first year of life. So understanding and for pediatricians and OBGYNs to understand just exactly what it is to have a postpartum mood, anxiety, and recognizing the signs that extend past that 2 to 3 week period is huge and key in terms of detecting it and also treating it.
Right. I have to add a few things as a pediatrician. We screen using the EPDS,
Yes.
which really is screening for depression and not anxiety.
It's only screening for depression, and it's only done, at least I'm just thinking about my own OBGYN, it's done right after at that postpartum visit, like 5 weeks after. But the reality is that things change over time. Studies have shown that like it really should be done like at the 1 month mark, the 3 month mark, right? And that one in particular, the Edinburgh postnatal depression scale, is really just for depression. But
Right.
anxiety, I think, studies have shown it. I think it's the prevalence is just as great
Yes.
as postpartum depression.
Or higher, or they could be together. I
Right.
would say
They could
anxiety
be
and
both.
depression is like peanut butter and jelly
Yeah,
of
for
mental
sure.
health. They
For
tend
sure.
to
They
go
come
together.
Yep.
Yeah. And a couple things more about that. The screen that we do is not always covered by insurance. And so sometimes parents decline it. And some are concerned about stigma or privacy and either don't answer it or don't answer it honestly. With or without a screen, I think it's really important to tell your pediatrician, we want to hear this
Yeah.
at every visit, right? And we screen, at multiple visits if the parent allows it.
Right. And pediatricians, I think it's wonderful. And I think as a pediatrician, I have total faith that this is something you're aware of, but I think not all pediatricians will ask mom how they're doing and how things are going, right? It's just, is the baby peeing, pooping, whatever it is, and right. But that's only one piece of the whole big picture.
Right. And it's hard because pediatricians today are under so much time pressure. It's really hard. There's the theory, and then there's the reality. So I'm going to encourage anybody listening to this, if you're going through this, be that squeaky wheel, because we can help you get help. But we don't know.
I like to tell my clients, right, the reason those screenings exist is because it's a real thing, right? it wouldn't exist if you were the only person in the world that was feeling it. There are ways of detecting it because it is so prevalent. And forget about it being prevalent. There's help. You can feel better, right? It's like, it's not, it shouldn't be that, oh, I have postpartum depression, I'm a horrible mom. It's not that. It's I have these symptoms that are causing me to feel this way. It's not I'm a depressed person. I'm a bad mom. I have symptoms that are making me feel a certain way, and I can get help and I can feel better.
Absolutely. And we need to talk for just a minute about the role of medication, because you are a therapist, you do not prescribe medication.
Yes.
It's something that's been a hot topic lately. There's been a lot of noise about these medications. And I would say very strongly, we're not here to give medical advice. I'm a doctor, but I'm not your doctor. But seek out a professional that you trust, right? And get a professional opinion. Don't listen to all the noise.
Yeah. And there are reproductive psychiatrists that are
Right.
trained specifically to manage and navigate the medication world when it comes to reproductive health and weighing the risks and benefits and what medications are safe and really that's their entire job, to be able to diagnose and prescribe and talk about this openly.
Right. Right. I do want to say, though, for an equity issue, that that's not accessible to a lot of people, either due to finances or to availability. And in general, OBGYNs prescribe medication
Yes.
for their patients. They do that. So you can go back to your OBGYN and say, hey, I think I might need this.
Yeah.
And the role of that during pregnancy, whether you had pre-existing medication, whether you're going to continue in pregnancy, again, beyond the scope of this, but it'd be great. Some people really need a reproductive psychiatrist. They have very complex needs, but some are, say, just on an SSRI, and OBGYNs, that's their
Yeah.
bread and butter.
Yeah. Especially during the postpartum period. I think it gets a little more complicated during the pregnancies, like whether medication is needed or not, and having someone who specializes is key.
They may be able to handle that too, and it's perfectly fine to start with them. All right. I just want to point that out here. We're not giving medical advice, but we want to make sure people have access to help and not just go find a reproductive psychiatrist and they can't, or they can't find one that covers, takes their insurance, or, et cetera. It's a problem.
Yeah.
But some people have very, very complex issues, and it can make a world of difference. And they may literally need that person to manage complex medications.
Absolutely.
And that it's true for nursing as well. I've seen it also where, a parent will say, well, I was on medication, but I stopped because I want a nurse. And again, your pediatrician and your OB can help you with that.
Yep, absolutely. And again, weighing like the risks and the benefits, right? If someone has major depression and they want to breastfeed, but they can't be on their medication, what are the implications for their own mental health and the well-being of the baby too? And being able to really sort of weigh out what's best. And it's not like a one size fits all situation either.
Right. And therapy can help up to a point, and that may be all that's needed, right?
In many cases, yeah. And in many cases, a lot of it is just knowing that this is something that will pass, and being able to work through it in therapy is a big part of obviously the healing. But a lot of people suffer in silence. A lot of people feel shame and stigma if they're not this ideal perfect parent that again is shown on social media and just the expectations. So being able to find a place to be held and to be able to work through whatever feelings arise. And again, there's a range in terms of severity of symptoms, but just having somebody to not judge and to be able to sit with you in whatever struggle there is I think probably more than half the battle, more than that. It's life-changing.
Right. And I think we're making great progress on stigma, but it still exists. And it drives me crazy because I don't understand, your brain is an organ in your body too. Like, why do we value it less? Why do we treat that as something that we're supposed to just power our white knuckle our way through? I don't know.
Yeah, absolutely. I say to my clients all the time, right? If you have strep throat, you're not just going to wait until it goes away. You have to do something about it. You have to go to the doctor, take medication, whatever it is. Why is mental health different than that?
Right. And for strep throat, you need to take an antibiotic. And for some of these conditions, or severity of these conditions, you do need to take medication. I'm still back. I'm still back on the medications. I just want to talk about that for just another minute. When do you refer your clients for an evaluation for medication?
So like you had mentioned the Edinburgh postnatal scale. There are certain scales that I guess are like strong indicators, right? Like if there's a certain score, right, it would be on my radar even before someone walks into the room. And usually I'll have my incoming clients fill out some of these scales. There's an anxiety one too. There's, depending on what the situation is. So there are indicators, I guess, on paper, but there's also a big piece of how someone presents when they come in, right? And as they're going through their story, I always like to tell me your reproductive story, right? Like, was the baby, if it's a postpartum mom, was this a wanted pregnancy? How did the pregnancy go? What were some of the challenges? And as I'm going through that intake process, just paying close attention. And as a clinician, you're trained to recognize some of the crisis, like the high risk factors that would really directly correlate with referral. And sometimes it can go either way, right? And often postpartum depression will resolve. And I have clients that come in and they say, well, my mom had this. She said it went away eventually. But do you have to suffer for that long, right? Like, do you have to wait until a year, 18 months to feel better? Or can you start feeling better now? So it's really, there's a continuum there.
Right. And don't try to white knuckle. You are not a failure if you need therapy, medication, or both. You're just not.
Yeah.
I don't know how to say it louder than that. I want to talk for a minute about the scariest end, right? Which is what everybody thinks about, the postpartum psychosis. And I want to also have you explain about intrusive thoughts that are not psychosis, because I wonder whether some people are afraid.
For sure. I'm so glad that you brought this up, because it's a big piece. A lot of people will be afraid to come to therapy because they're having thoughts that are scaring them, right? That I'm scared I'm going to hurt my baby. I'm scared that I'm going to, kill my baby. I'm scared. There's the list goes on and on. There's actually a book, and I'm staring at it right now. I guess I'll hold it up. It's called Good Moms Have Scary Thoughts. It's by Karen Kleiman, who's one of the leading postpartum anxiety and mood disorder clinicians. She's written so many manuals, and you can tag this if you want to. And it's
put it in my thing.
And it's actually it's almost like a graphic novel, I guess. And basically the whole point of the book is to normalize that it is normal to have scary thoughts and to worry to some extent, right? It's when the worries get excessive, that's one thing. But there's a difference between worrying that something bad is going to happen and believing that that this is something that you need to do. So like there's a term called ego syntonic versus ego dystonic. So if somebody came into my office and told me, and this happened just last week actually, I am so scared that I could be capable of killing my baby. Like they heard a story on the news, and like I'm so scared that I could, if I could ever possibly do something like that. There's a difference between that and someone coming and saying that I'm having thoughts that I need to hurt my baby, that the baby, whatever it is. If a thought is ego dystonic, like the first example, where the mom is coming in and they love their child so much that they're afraid that they're going to hurt them, or that these intrusive thoughts are coming in, to me, that's actually the best news possible, because here you're scared. You're having a scary thought about the safety of your baby, and you're terrified, right? It's, if the thought is in line, if your beliefs about the thought are in line with the actual thought, then you're walking into some other territory of like postpartum psychosis, or there's an actual danger there. So a lot of moms won't come into treatment because they're having these scary thoughts, and they're afraid that if they verbalize them, then the baby's going to be taken away. The baby's going to be put in foster care, or they're going to be deemed as not safe and they're going to be hospitalized. But the reality is a lot of these thoughts are normal to have.
So glad you pointed out about that book, and I definitely have to put it in the show notes. It's really, really important. And I'm glad you clarified that. I know you have to go. I just want to do one more thing. I think it's really important, which is, say someone's listening to this and they're like, well, it's not about me. It's about my daughter, my friend. I'm worried about them, because I'm guessing not everybody knows to get help or is able to articulate that for whatever reason.
Yes. Yeah.
Your friend, your family member that may be suffering from a PMAD, one of these mood disorders, and is not either aware of it or not admitting to it, you suspect it.
Right. So, I mean, the first thing I would say is recommend that they talk to like if they're not in therapy. So if something's going on, to talk to their pediatrician or their OBGYN. Again, as time goes on, my goal and my hope is that offices will be more trained to be able to detect some of these things, even if it's not so obvious to, I guess, the person sitting next to in the lobby. But there are a lot of self-help books too, like the one that I just told you about. But I think the key is, if in an ideal world, if I guess everyone can realize that this is sometimes it's part of the journey, right? It's that things are not perfect from day one. Things will never be perfect. And the struggle is real. It's there. And even if you're not diagnosed, or if you aren't struggling with clinically diagnosable anxiety, depression, OCD, right? Being a mom is hard. And no one has the answers, right? You mentioned the Good Enough Mom and Winnicott, who he's known for the saying, the Good Enough Mom. A baby doesn't even need a perfect parent in order to be successful. And in fact, it's through some of the imperfections that a child learns to be resilient. So I just wish women wouldn't put as much pressure on themselves.
My gosh, so much, so true. And by helping yourself, you're ultimately helping your child.
Exactly.
So I think that that's really important. But for someone who sees a family member or friend, I'm going to put things in the show notes about hotlines.
Yes.
Because you yourself can reach out to a hotline.
Yep, there are
right?
hotlines. You can put them in the show notes as well.
This is not, yeah. So I think we've covered a lot of ground in a short amount of time, but we didn't go into anything in depth. So I'm hoping you're going to come back for a multiple part series so we can have short and sweet pieces of this more in depth.
Okay. Yeah, I am ready. Tell me when.
Amazing. Thank you so, so much for doing this with me.
Of course.
Thank you for listening to Kids Matter. Raising healthy, happy children takes a village, and I'm grateful you're part of ours. If today's conversation resonated with you, please share this episode with another parent, grandparent, teacher, or anyone who cares about kids. Together, we can build the supportive community our children deserve. I'd love to hear from you. Share your thoughts, questions, or suggestions for future topics at kidsmatterpodcast@gmail.com with no explanation point. Your voice truly matters. Until next time, keep advocating for the children in your life, because kids really do matter. They are our future. I'm Dr. Elisa Minkin, and this has been Kids Matter. Please note that while I am a pediatrician, I am not your child's pediatrician. This podcast is for informational purposes only and does not constitute medical advice. For any medical concerns or decisions, please reach out to your child's healthcare professional.